We're going to talk about how to correctly measure blood pressure because there is so much confusion over this topic. And we have America's best cardiologist, Dr. Peter, who is going to run through this. And it's really important that you know this. And before we get started, we are very excited that Ojais Wellness has partnered with Holland and Barrett, one of Europe's leading natural health and well-being brands. So if you're in the UK or Europe, do check in the links down below. Our products are now on the Holland and Barrett website. We are honored by this. Let's dive into this topic then. Dr. Peter, blood pressure.
Sure. This is such a great topic to talk about because this is what I see every day. And so I think what really we need to drive home with this is that people come in all the time to their doctor's office and your blood pressure may spike up just coming to the doctor's office and get that what we call white coat hypertension. And coming in really to a doctor's office right away is probably not the most reliable way of checking your blood pressure. And some people unfortunately get put on blood pressure medications based off maybe one reading. So what we want to make sure is that people can do this properly at home, because if you can get home blood pressure readings in your more natural environment and under normal conditions, then that might be a lot more helpful to your doctor, or maybe helping you avoid being on blood pressure medications because your blood pressure may not be that high, maybe a lot lower at home. And so a couple things. So one is, I always say doing blood pressure in the morning, all right? I wouldn't, even though I'm a big fan of exercising, no exercising 30 minutes before, no caffeine, and definitely no smoking, but hopefully just no smoking in general. And what you want to do is you want to make sure you're comfortable, it's a quiet environment, and you really want to maybe rest for 3 to 5 minutes before you measure. And so what you want to do is have the cuff appropriately on your arm. And I'm a big fan of the cuffs and not the wrist cuffs. I think the arm cuffs are much more reliable. And I always say take 3 measurements in about 1 minute apart, and then throughout the first measurement and take the 2 last readings and average them out. Record those. Don't go crazy checking your blood pressure multiple times a day. I think in general, that is going to raise your blood pressure. And remember, if you check your blood pressure too many times at once, it can cause spasm of the artery a little bit. That you check your blood pressure, it can falsely elevate it or lower it.
Interesting. Thank you for that. So no food either first thing in the morning. And yeah, those are very important tips there.
Yeah.
Being relaxed is just so important because how many people go to the doctor's office and they are worked up, maybe you've sat in traffic, maybe you've waited too long, maybe you're nervous about seeing the doctor, white coat hypertension, although we hope nobody gets nervous seeing us. But that's a huge topic as well, isn't it?
Absolutely. The other thing is just making sure your feet aren't crossed or your legs aren't crossed, because that can adversely affect your blood pressure. And just making sure that you have the right cuff size. You're not using a big cuff, but just a normal adult size cuff if you have a normal adult size arm.
Yeah, exactly. So sitting down comfortably in the morning, no food, caffeine, obviously no cigarettes beforehand, and then check your blood pressure and go over the positioning again, ideally, so that people really get it in there.
Yeah, I mean, I think you want to have really your arm at your heart level, all right?
Okay.
Because if it's above or too low, that can essentially lower your blood pressure or raise your blood pressure. Again, having your cuff appropriately placed, the width of the cuff should be about 40% of the circumference of your upper arm and about 80% of the length. Again, the right size cuff, because an overly small cuff can increase your readings, while an overly large one, like an adult cuff for more obese patients, can artificially lower your blood pressure reading. And again, the arm cuff. So at heart level, no caffeine, no exercise, no smoking, 30 minutes before, quiet environment, relax, uncross your legs, feet flat on the floor, 3 readings, 1 minute interval apart. Throughout the first reading, average the last 2, and don't keep repeating that all day. All right?
Interesting.
Write these down in an organized fashion. Bring them to your doctor when you see them for your follow-up.
And go over the whole right arm, left arm thing then, because a lot of people get confused about appropriateness of the arm to take blood pressure. And a lot of people ask questions, should I check in the right, left, both? What's the advice?
I think most people will use the left arm, and that's probably because a lot of blood pressure cuffs out there are really designed for the left arm, and people probably use it out of convenience or just habit. A lot of doctors will do that. But what you really should do is you should be checking both arms initially, and whichever one has the higher reading going forward is the one that you should be checking. Now, if there's a big discrepancy between one arm and the other, that's something that you should know and talk to your doctor about, because that can be suggestive of certain vascular conditions that you want to be worried about. But ultimately, it's about being consistent every time and really just making sure that if you have a discrepancy and one arm reads a little bit higher than the other, use that higher one, even though you feel like you'll get lower numbers using the lower one.
Okay, that makes sense. Use the higher one. And I want to come back to this checking multiple times a day. I completely agree. If you are checking it and just want a record, want to know what your blood pressure is, often actually what I recommend, and feel free to correct me, Dr. Peter, if I should modify my advice a bit, but I recommend when people have been told that they might need a blood pressure medication and they're very nervous about this, I say keep a log 3 times a day for a couple of weeks in that circumstance when there's a concern that your blood pressure is too high, maybe you don't need a medicine. I am curious to know what it is in the afternoons and evenings and whether it's spiking up in that circumstance.
I think if we're in a situation where it's becoming the choice of whether you need to be on a medication or not, I think that it's reasonable to check it multiple times during a day for a set period of time. And I emphasize a set period of time, like a couple of weeks, because again, over checking your blood pressure causes apprehension and anxiety, and isn't really going to make anything better. And so you just want to make sure that if you're being treated for high blood pressure, that your doctor also compares your home reading with what also they're getting in the office. And it's not just based on 1 or 2 readings.
Okay. Thank you very much, Dr. Peter. That was great. Now, I'm sure a lot of you have a question about what is the ideal blood pressure. We will link a video to the end of this, which was a podcast we did on how blood pressure is just a number. But we'll each make a statement on blood pressure being just a number as well, very briefly, to portray our thoughts on this. So I agree completely. I think it's ludicrous that everybody has a blood pressure which is ideal of 120/80, whether you're 20 or 80 years old. Your blood pressure is unique to you. And remember that many people, blood pressure can fluctuate with age. In some people, it will go up because of calcification of the vessels. In other people, it actually comes down a lot, especially past the age of 80. So be careful. And I definitely wouldn't recommend the mantra of one size fits all.
Absolutely. So blood pressure is very dynamic. It's your body's really response to its environment, both externally, internally. So there's just so many factors that can affect your blood pressure. So you want to take that into control or into an account and really try to control the things that you can control. So again, managing stress, reducing stress, always a little bit hard, but managing it is probably a better way of looking at it. Being the best you can be metabolically, exercising regularly, those are things you can control. Some people just genetically have predispositions for higher readings. And if you have to be on a medication after making all these lifestyle changes, it's not necessarily a failure. But again, it's always better to strive to do it naturally if you can first. It's better for you. It's going to make you feel better.
Absolutely. Yes. Okay. So we hope that that was helpful to you. Feel free to leave a comment down below. We really enjoy hearing from you. Again, check in the links down below if you're in the UK, Europe, for our Holland and Barrett site listing. And if you're in the United States, ohiwellness.com, our natural health and well-being store, which we're very excited to be expanding. Also, if you haven't already downloaded our Metabolic Mastery Guide, free metabolic guide, that's down below. We're cheering you on your health journey. We wish you the very best. We'll speak in the next episode.